Okay, so your client is now presenting to you with unilateral lymphedema, no trunk involvement. Now, although there's no trunk involvement, we still have to prepare the trunk to accept the fluid that we're going to move from the arm. So we'll start, as always, with our short neck. We'll start with our effleurage 2 to 3 times. Okay, so I'm going to move down. I'm going to go to in breathing. So go ahead and take a deep breath in and relax. Okay, take a deep breath in and relax. Deep breath in and relax. Deep breath in and relax. Take a deep breath in and relax. Deep breath in and relax. Deep breath in, relax. Deep breath in and relax. Back to the navel, deep breath in and relax. Okay, so we will now stimulate the axillary lymph node on the unaffected side, so the clinician should change sides of the table. Okay. 5 to 7 times, stationary circles. That skin stretch going towards the table and then towards the axillary lymph node. All right, so we're going to activate and open the AAA. We first do that by putting a little finger on the sagittal watershed, and we're going to go in the unaffected portion towards the unaffected axillary lymph node, 5 to 7 times. Okay, we're going to do the same thing over here. Little finger on that sagittal watershed, 5 to 7 times, going towards the unaffected lymph node, axillary lymph node. Okay, so now we're going to work from the affected extremity to the unaffected axillary lymph node. So we're going to do that by your traveling stationary circles 5 to 7 times. Okay, so we've opened and we've activated the AAA, which is a 3-step process. Now we're already over here, so we're gonna work on that working inguinal lymph node. We'll start by putting our little finger knuckle in line with the ASIS right in that femoral triangle. Always best to do it on skin. Skin stretch. So when you're working with your clients, you will need them to disrobe depending on which part or quadrant of the body you're working in. Doing this 5 to 7 times. All right. More medial hand placement, 5 to 7 times. All right, so now we're gonna activate and we're gonna open the AI axilloinguinal anastomosis. Okay, so we're going, this is the unaffected quadrant and this is the affected quadrant. So I'm going to put my little finger on that 12th rib and we're going towards the working inguinal lymph node. Okay, now we're going into the affected portion of the quadrant. I'm going to put my finger on the superior border of that inferior rib, 5 to 7 times, going towards the inguinal lymph node. All right, and now in order to work from the axillo to the inguinal, the clinician is going to need to change sides of the table. There is nothing to say that you can't change sides of the table when you initially begin to open and activate this anastomosis. Do whatever is more comfortable for you as the clinician. And we're going to do this 5 to 7 times, moving that fluid from axilla to ASIS. All right, so we've activated, we've opened that AI anastomosis, so now we're going to rework that AAA. I'm going to go ahead and switch sides of the table to do that. So when we rework something, we just perform the third step of opening and activating, which is actually working it across the anastomosis, and we only do it 2 to 3 times. So we're doing it from the affected to the unaffected side 2 to 3 times. I'm going to use those stationary circles. All the way to the axilla 2 to 3 times. Okay, while she's here, let's go ahead and rework those shoulder collectors. Just reworking, so just 2 to 3 times each hand placement. All right, so we reworked the AAA, reworked the shoulder collector. So now we're going to have that client lying sideline with the affected extremity on top. Of course, if possible, you want to position them with pillows, with wedges, so that they're comfortable. They can hug a pillow as well. From this position, we're going to go ahead and rework that AI, which is again from the axilla to the inguinal. We're going to do that 2 to 3 times. We're just reworking. You might have her just relax her arm right there. Okay, Now, while we're in this position, we're going to also open and activate the PAA, which is the posterior axillo-axillary anastomosis. We're going to be going from the, we'll start in the unaffected quadrant. So we're going to start right here. My little finger is on that sagittal watershed. We're moving towards the unaffected axillary region. And you can see right there that her shoulder is pretty up in her ear. So as soon as I'm done with this, I'm going to try to reposition her to get her shoulder a little bit more comfortable. All right, can you bring the shoulder down? There we go, much better. Okay, and now we're going to do the same thing over here, moving towards the unaffected axillary region. Okay, so now I'm going to move it from the affected to unaffected axillary region, moving all the way across that PAA anastomosis. All right, so we're going to start stimulating that arm now. We're going to start by doing it by activating the bulk flow on the lateral upper extremity. So remember, you have this cephalic bundle on this lateral upper extremity. So I'm going to put my hand, one hand on the posterior deltoid, one hand on the anterior deltoid. And this is actually called hand washing, but really it's just stationary circles. So you're doing a skin stretch and you're going towards the working lymph node. Skin stretch towards the working lymph nodes. Really, we're going towards those good shoulder collectors as well. So you have two things that can help you with this technique: shoulder collectors and the working lymph node, axillary lymph node. All right. So we did that 5 to 7 times. While we're here, let's go ahead and rework the PAA. So remember, when you're reworking anything, 2 to 3 times. So we're going to go from the affected to the unaffected side 2 to 3 times. Okay. You can also, while you're here, go ahead and rework those shoulder collectors 2 to 3 times. And then while you're here, go ahead and rework that AI anastomosis 2 to 3 times. That doesn't look very comfortable for my patient. Okay, so we're going to now position your client in supine if they can't tolerate, I'm sorry, not supine, in prone, if, nope, supine. Okay, we're going to rework the AAA, working from affected to unaffected, so we're reworking, so just 2 to 3 times, the last step of open and activating the anastomosis. Okay, and we're finally going to get to that arm. So we're going to go ahead and start working down the arm, and then we're going to work up the arm. Okay, so we're going to start by draining the lateral aspect of the arm. You can do this however your client's most comfortable. We're going to use the push stroke to go up that lateral aspect of the arm. We're going to do that 5 to 7 times, and you're going towards the acromion process. So you'll have to do a lot of education with your clients as to why you are just now starting to work the arm. You have to let them know that you have to decongest that trunk first before you can start moving fluid up the arm. Everything 5 to 7 times. Okay, now we have to go, we did the lateral aspect, so now we have to go from medial to lateral. Remember, we're using that cephalic bundle again. So in order to go from medial to lateral, I'm going to use dynamic stationary circles, and it's really your MCPs that are working. So although it looks like my whole hand is treating her right now, it's really this portion of my hand, so you're going to work in rows. So I'm going to start from medial to lateral, 5 to 7 times. Okay, now I'm going to do another hand placement down. I'm probably going to get 3 hand placements going from medial to lateral 5 to 7 times. All right, last hand placement. Now at the end of this last row, I'm just going to go ahead and perform a pump to pump that fluid that's now in the lateral aspect of the arm up towards those shoulder collectors. Do that 5 to 7 times. Okay, so now we've worked the medial aspect of the arm, so we're going to move down to the elbow and we're going to drain that antecubital fossa. We're going to have a superior hand placement at the joint line placement and an inferior to the joint hand placement. You can do 2 things. You can perform thumb circles, but this is a thumb circle, but I'm actually going to perform those stationary circles 5 to 7 times above the joint line. At the joint line, and below the joint line. Okay, so now we're going to be working both the anterior and the posterior forearm. You can do this using many different strokes. I'm going to actually use the scoop and then the pump so you can get this done at the same time. Okay, so the scoop, we're going to start, we're going to scoop the posterior and then we're going to pump the anterior. This is a little bit more efficient. You, of course, as the clinician, want to watch your body mechanics. Okay, so now we're going to move on to the dorsum and palmar surface of the hand. You can use thumb circles, just like we did in the antecubital fossa. You just have to make sure that you are dividing and getting the whole hand. So what I opt to do, other than the thumb circles, I want you to go ahead and relax your arm, is I actually do a stationary circle, because then you're getting the whole surface of the hand 5 to 7 times. We typically don't do MLD on the fingers. That will be addressed with your bandaging. Okay, so we did that palmar surface of the hand. Now let's do the dorsum of the hand 5 to 7 times. Okay, and so now we're going to start moving up that arm again. We're reworking, so we just have to do everything 2 to 3 times. Okay, so we're going to rework that anterior and posterior forearm. Okay, we're going to rework the antecubital fossa. We're going to go below the joint line 2 to 3 times, at the joint line 2 to 3 times, and then above the joint line 2 to 3 times. Rework the medial aspect of the arm 2 to 3 times, each hand placement 2 to 3 times. And of course, now I'm going from distal to proximal. Okay, so now we're going to rework the lateral aspect. I'm going to do that using the pumps, just 2 to 3 times, all the way up over to the shoulder collectors. You can also do stationary circles. All right, so now she's here. We're going to rework that AAA from the affected to the unaffected 2 to 3 times. Okay, we're going to rework the axillary lymph node on the unaffected side 2 to 3 times. You can notice that she has positioned her legs up, so if your client does that, you might want to get a bolster to put underneath their legs. All right, we're going to rework that inguinal lymph node 2 to 3 times. All right, we're gonna effleurage the affected part of the arm, the lateral aspect, 2 to 3 times. You're trying to stimulate goosebumps because you're stimulating that autonomic sympathetic nervous system. And we're gonna end with abdominal breathing. So go ahead and take a deep breath in and relax. 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 And last time, deep breath in